Good evening, everyone. This is Miss Harper coming to you live on THCOD for your health information. Today, we're going to talk about Chapter 9 in the Insurance Fortney book, 14th edition, and it's talking about receiving insurance payments and solving insurance problems. Solving insurance problems, okay? And maybe somewhere in the middle of all that, we're going to find out whose job it is. Is it yours? Is it his? Is it hers? Is it everybody's? Okay, pull my beautiful book over here with me. Okay. Now, we're coming out of chapter 14 in this lovely book here, 14th edition. Okay. My night students, they have the regular handbook of that book, and they also have the workbook of that book. Okay. So I really admonish anyone that's going to take up medical billing and coding in class, please learn from your instructors. They may teach a little bit unorthodox as I do, for you to learn as much as you need to. And you have to complete the program to get your certificate of completion, so that you can put that on your resume and also qualify for a particular coding certification. Now, they have different coding agencies that you can acquire a coding certification. Okay, so I'm going to write two of those agencies down as we speak. Okay, so you have NCCT.inc, and this is just like it is on the internet, just like that. www.ncct.inc. Okay, now that certification would be a certified, I'm sorry, wrong institution. That's for my day job. Let me tell you what my night job people qualify for. Okay. Well, let me say this anyway. You can get this, so let me say this. Certified Medical Office Assistant or National Certified Insurance and Coding Specialist. That's what this acronym means. Certified Medical Office Assistant, National Certified Insurance and Coding Specialist. Okay, agencies are like companies that give you rights to say you've been tested, you know what you're doing. Now you can tell the world wherever you work, and once you get certified, you are certified within the whole 52 United States that I know of. Don't quote me on that, but that was my understanding. But you can call the agencies to be sure. If I'm wrong, please tap me on the YouTube and let me know. Ms. Harper, we found our clarifications, and this is what it is. And I don't mind being open to learn. I am a lifelong learner. But remember, if you're going to step to me with information, you better come correct or don't come at all. Okay? All right. Now, then we have in National Alliance Healthcare Professionals. And I think it is .org, if I'm not mistaken. But this is National Alliance of Healthcare Professionals. Let me look, make sure. There you go. Okay, yeah, that is it. Let me make sure I have it right. I'm at the board here. Hold on. Make sure. NAHPUSA.com. Okay. NAHP USA. Let me write that. USA.com. Okay. Now, this will allow you to be a certified medical administrative assistant. Okay? Certified medical administrative assistant I think it also has on there where you can be, I forgot some other certifications on there that's dealing with building and coding. But make sure that you look for other certifications on this agency that would allow you to also be certified in other areas that are inclusive to medical billing and coding. And again, if I am wrong, please chime to me on there or let me know via email and I will come back and correct that. Okay? All right, fantastic, fantastic. Okay, so now we got that out the way. And remember, once you're certified, you are certified within the whole 52 United States. Okay, 52 United States. Okay, all right, I have to appropriate myself. I'm a breast cancer survivor, so I have to appropriate myself. Okay. Okay, so in chapter 9 of the Insurance Fordney book, the 14th edition, okay, we're learning about advanced beneficiary notice of non-coverage, aging report, appeal, delinquent claim, denied claim, explanation of benefits, inquiry, insurance payment poster, insurance insurance payment posting, loss claim, medical necessity, overpayment, peer review, rebill, which is resubmit, reimbursement, rejected claim, remittance advice, review, suspended claim, suspense, and tracer. Okay? All right. Very good. All right. So here we are. Service to patients. Okay, so to reduce insurance problems and obtain correct maximum payments, it is vital to extend service to payments by doing the following. Okay, assist patients with an in-office registration procedure so that complete and accurate information, personal and financial data, are obtained initially and during the follow-up visit to help diminish denied claims. Okay, so sometimes when you're a new patient to the doctor's office, sometimes you're going to fill out those 9 and 10 sheets of paper. Or you have a more technically savvy doctor's office where they're going to have an area full of computers and they're going to tell you how to step by step on the computer what to click on next. And sometimes they may have someone over there to assist you on completing out online information, okay? Which is still like 9 or so pages long, except it's just virtually done as a soft copy rather than a hard copy by paper, okay? Now, if you only notice that when you go to the doctor, sometimes it'll say, do you have change of address? Do you have updated insurance? They like for you to fill out these updated sheets every time you come in. I don't care if you came in today, Wednesday, and you're coming back in next Thursday. But I just filled out a form. Yes, and things happen within the next 7 days. You could lose your job. You could be moving somewhere and you forgot to tell us, okay? So sometimes we have to have those sheets and we have to get you to sign those sheets every time you come in so we can keep record of that. So we have proof, we have paper trail that you told us last week, this week, next week after that, Monday after that, month after that, 2 months after that, that you have told us that you did not have new insurance, you did not have a new address, okay? And so we have to come back and let you know, hey, we keep a record of all of this. You came back on this date of service. This is what you signed and said. You said you didn't have a new address. So are you telling me you moved and maybe perhaps you forgot? You told us you didn't have an updated insurance or a change of insurance or that your insurance had terminated. So maybe you forgot. Okay. Okay. So We have our strategies to find out, and we have our strategies to legitimize what we do, okay? Number two, to ensure that the patient has provided information about his or her employer, the subscriber, relationship to the subscriber, and the subscriber's date of birth. Okay, so the employers, again, sometime on this sheet, you may say, I now work at Dow Chemical versus where you worked at Chevron, okay? Or ExxonMobil, okay? You, the subscriber is the policyholder. The subscriber is the one that has subscribed to the insurance through their job, okay? And they have subscribed and supply insurance for their spouse, for their kids, for their family. So it'd be employee and spouse, or employee and family. That includes the spouse, okay? So that's what that means. It's important to have the subscriber or the policyholder's date of birth. I have my husband's date of birth. He's the one that is covering me. So when I go, I have to give his date of birth, okay? Because that's how they can easily distinguish who he is among everybody else in case there's a misprint of the subscriber ID or whatever, okay? That's why we have to have that information. And then when you sign up the family, you got to have the spouse's date of birth. You have to have the children's date of birth, so that when you call the insurance company, they can relate to the dependents of the subscriber or the dependents of the policyholder. Do you hear how I'm explaining policyholder, subscriber, policyholder, subscriber? Interchangeable words, but they mean the same thing. Okay? All right. Verify the patient's insurance coverage. If a patient does not have active coverage and services are going to be provided, it is important to communicate to the patient that the patient is responsible for all charges and collect payment prior to providing services. So that's why a lot of times you get those automatic calls from your doctor's offices. I know I have my doctors. Their phones are set up to where they will call me on Sunday while I'm in church. That automatic, that Rolo dialer or whatever you call that, it'll call, and I'll be like, why is Dr. So and so calling me? And I'm in church. Why they calling me? It's not their office, it's their automatic dial system. But I'm not offended with that at all. I think that's great because sometimes on weekends you need to be mindful. Hey, you got an appointment Monday morning. Hey, you got an appointment Tuesday morning. I think that's great because my life is busy. Is your life busy? Wouldn't you appreciate that? I know I do. So don't take it personal. It's just an automatic thing that's set up on the appointment setter that lets them know, hey, this is Saturday, she needs to be reminded. Or this is Sunday, she needs to be reminded she got an appointment on Monday. Don't miss it. If you miss that appointment on Monday, now you're probably asking that question, well, why are they charging me for a missed appointment? Glad you asked. If you set that appointment a week or two ago, maybe 2 or 3 days ago, and you booked it, and it does happen, okay? Sometimes they'll excuse that $25 or $35 missed day charge fee. But now if you just missed it on a continuum, that is a time slot that another patient could have had that really needed to be seen. And if you're going to be, how can I say, light-minded about it or light-hearted about it, then yes, we do have to charge you $35. Ooh, that hurts. Yes, it does. I know it hurts. That pocketbook just hurts when you have to give it away for something for nothing, right? But we have to do that so it'll make it stick in your mind. Don't miss an appointment. Now, if you call and cancel the appointment 24 hours in advance, or maybe that morning and your appointment is at 4 o'clock, okay, maybe there's a high chance you might not get charged for that, okay? But again, that could have been an available time slot, not so much for them to make money, but for a patient that really needed to be seen, that time slot won't go wasted, okay? So we're all about not wasting time, not wasting space, not wasting opportunities, okay? Make room for someone else because you never know. There might be you that needed that missed time spot. and you needed to be seen, and they say, oh, yes, ma'am, I have an open time slot at 11 o'clock. You want to come on in? Ma'am, I'm around the corner. I'll be there in 5 minutes. Okay, so you got to think about that. Going to the doctor and being cared about a doctor is not about just money. It's not about just you. It's about everybody else too. So you got to get out that me syndrome. Me, 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 me. Okay. All right. Now, to verify insurance coverage, yes, we do. If you're coming in on Wednesday, we're going to verify Friday or Monday. If we find out Friday and Monday for your Wednesday appointment that your insurance is terminated, we're going to call you and say, hi, Mr. Hi, Mrs. I understand your insurance has terminated. Do you have any other coverage? If you don't have any other coverage, then we have to tell you that your office visit may range, if you're an established patient, your office visit may range $100 to $250. So be prepared to pay for your visit. Oh no, ma'am, I don't have any other insurance. Is there a way I can reschedule? Okay, so notice we called you Friday or Monday to let you know about your Wednesday appointment, and you said you didn't have any of the coverage, and 100 to 250 was just a bit much for you, so you're not ready for that. Then by all means, you should not be charged for a missed appointment or a cancellation appointment. You shouldn't be charged. Then it makes it easier for them to reschedule. And again, it gives 2 more days or 3 more days for someone else to take that missed time spot to be seen. And we can keep on a budget, because everything in life happens on a what? Budget. Budget is healthy financial boundaries. It helps you in your spending on what to do, what not to do. Okay. So doctor's offices, we have to get paid. We have to tell people, we need our money. We're not desperate for money, but in order to keep me alive and functioning to serve you, please pay us your copay. Please pay us your co-insurance. Okay. That's it. That's how it goes. So we have to verify your insurance. Okay. Next one, post a sign visible to all patients that co-payments are collected at the time of visit. Now, sometimes co-payments are collected before you go back there and see a doctor. Sometimes co-payments are collected on your way out. Be prepared to tell your patients, and be sure you have on the window, what method of payment do you accept? What credit cards does the doctor accept? If he accepts checks, please put on there the policy for NSF checks. Whatever your bank charge, you charge them sensibly the same way. If your bank charge you $5 per bounce check, then the policy rule for what a person charge, a merchant, a doctor can charge is $25 or $30 for NSF checks. Why? Because it throws their anticipated budget off. Okay, so we have to charge that. Okay, so be mindful. Don't be mad, just be mindful. Okay. Prepare a letter or form for the patient's signature if the patient has a complaint about a third-party payer, and send it to the local insurance commissioner complaining the problem or asking for help resolving it. If for the patient's signature, the patient has a complaint about the third-party payer. Okay, so if you're going to advocate on a patient's behalf on writing a letter, there is a format in this chapter on knowing how to do that. If you're going to do that, then you need to know how to write in such a lingo that will help. Now, we're in Texas, so if the patient does not appreciate or like how the insurance is being paid as such and such insurance, and they're residing in the state of Texas, and the policy was underwritten according to the regulations that's in the state of Texas, they can write to the Texas State Board of Insurance to have that rectified. Okay? And you got to know how to do that. Now, a person of experience, if you have 2 and 3 years experience, then you would know your lingo and how to talk to the person and how to advocate. Okay? If you're fresh to the game, like I say, fresh to the industry, you're 6 months in, you're 1 year in. Some of y'all can grab real fast and know how to do that. Some it's going to take y'all a while. So don't be hard on yourself. Give yourself time to this. It's going to take you 2 and 3 years to be an aficionado if you're consistent in your field. Okay? All right. Learn as much as you can. Don't be closed-minded. Learn as much as all you can. It takes you a long way. And remember, be a lifelong learner. Don't shut yourself down to just billing and coding and that's it. Be open. Be open. Okay? All right. So response from a submitted claim. You have delay in reimbursements or payments to the medical practice can also occur when the health insurance company state that they did not receive um, the claim at all. At times, the insurance company may reimburse claims lower than expected, which after which an appeal can be filed. The management of reimbursement process in insurance denials is known as follow-up. Okay, so you have to follow up, and there's a method to all of that. Okay, so let's write that on the board how that works. Okay, where follow up is. Okay, so let me erase all of this. Okay, follow up. Follow up. Oh man, that's bad. Look at that. Okay, so from a billing standpoint, being a medical biller, okay, you're going to follow up on clearinghouse, okay? Clearinghouse when they have what? Rejected claims, okay? Rejected claims, okay? You're going to follow up from different insurance companies. Okay, how do you do that? By way of the internet, the website. So let me write that down. By way of the website, okay, website, EOB, explanation of benefits. You're gonna follow up like that. Okay. Sometimes you're gonna follow up by EOBs. Okay. And again, what I said about EOBs, they can respond in what kind of way? As paid, pinned, or denied. Okay. Now you have three categories. Okay. So let's say Sally works the payment one. She may post or do a follow up here. James may do a follow up on all the pending claims, and all the claims over here may be done by Stacy. Okay. So you have some billers or some follow up teams will do all of the paid EOBs, and they're going to what do you call that? That's Scamager, but scrub through the EOBs to make sure, did this pay correctly? Did this pay lower than normal? Could this have been paid more? What did we miss in that? Okay, and if you look and compare to the SOAP notes, you may say, oh, we should have used modifier such and such. So let's see if we can appeal this and then send it back to the insurance company with a copy. Don't send the original ELB. Make a copy. You make a copy and send the original. You keep the copy. Okay. And you have to stamp on there what day you reviewed this at your doctor's office, and in order to know that, okay, I reviewed this, I sent this to a letter. With a letter, they need to respond back to me per such and such date. James may handle all pending claims. Okay, so it means he needs to search whatever is being requested for the pending claims. He needs to put a date stamp that he worked that pending claim in that office, and then he needs to work those stacks of pending claims. Okay, and then he needs to send that out. Remember, make a copy, send back the original plus the letter or whatever you have written to get that pending copy and of the extra information that they request, and send it off, and make sure that you send it off in a timely fashion so that they can respond back to you. And make sure that when you stamp the dates on there, that stamp date is also on the original EOB. So when you make the copy, the stamp date is already on the copy of which you sent the original paperwork. Okay. All right. And then also keep copies of the letters that you sent to the insurance company. until that claim has been fully paid, properly justified. And then once you do that, then you can put it in the shredder bin to be destroyed. Okay? All right. Now, same thing for deny. You can work all the denied claims. Some claims are denied incorrectly, and you can go back and fix it. Same thing. You need to put a date stamp on there. If you can appeal that denied claim, then write a nice letter. Send the original ELB with it, send the original letter with it, and then wait for the appeal. Work the appeal and wait for the response for that. Until it comes back and is fully paid, then you can put it in the shredder bin. Now you have three sets of people working this. Now, if it's a smaller office setting, then maybe you can work this on a Monday, you can work this on a Wednesday, you can work this on a Friday. You have to know how to maneuver the work around your work schedule to get things done. Okay? You could be a jack of all trades, but you got to figure out how to get it masterly done. Okay? I know it says jack of all trades and a master of none. Well, you got to get something masterly done. Okay? And so sometimes you got to put up them boundaries and tell people, don't bother me sign for 2 hours. Okay? All right. So this chapter begins with the provisions of payments in the insurance contract and explains how this affects the timelessness for payment. The text demonstrates how to interpret the document that accompanies payment and how to manage and organize financial records. To improve cash flow, numerous problems that can occur are presented and some solutions are offered. Finally, the review and appeal process for various programs are discussed. So, claim policy guidelines. So, let's talk about that. A patient who seeks medical care with a healthcare insurance card is presenting the contract that he or she has with the insurance company. In other words, the insurance company issued the card to the patient as evidence that it takes responsibility to pay the medical practice for the services for the patient received. As discussed in Chapter 7, in order for the medical practice to get paid for these services, insurance companies require the medical practice to submit a claim form. The insurance company dictates the guideline for claim submission, such as services are covered, the reimbursement rates, and the time limits for claim submission and payment. Now, we have the insured, okay? A patient insurance card does not specify the detailed benefit coverage. Okay. For example, maternity is an optional benefit. Therefore, a physician should be aware that providing maternity care to a patient with no coverage, he or she may be at risk of not being reimbursed. Another example is that there may be provision that the claimant has an obligation to notify the insurance company of a loss, such as injury or illness or accident, within a certain time period, or the insurer has the right to deny for benefits or deny for benefits of the loss. In some policies, if the insured is in disagreement with the insurer for settlement of a claim, a suit must begin within 3 years after the claim has been submitted. Another provision states that insured person cannot bring legal action against an insurance company until 60 days after the claim has been submitted. Okay? So that gives you a guideline of what is the statute of limitations. Okay? So you have up to 3 years after the claim has been submitted to file for an appeal. That's the statute of limitations. It used to be 2 years. Now they have changed that. You can't really file for a complaint, if you will, until 60 days after the claim has been submitted. So you have a complaint and you have an appeal. It's similar, but it's different. Okay. Electronic claim submission. Okay. So within the electronic claim submission, you have the Administration Simplification Compliance Act that prohibits payment of initial healthcare claims not sent electronically as of October 6, 2003, except in limited situations for Medicare and other government-sponsored insurance programs. Most other private health insurance programs have also eliminated the use of paper. Workers' compensation insurance plans are the only group that uses paper claims on a regular basis. So uh, this is talking about the use of electronic claims. You're going to eventually learn what is called meaningful use. Meaningful use, and that's learned in medical meaningful use. That's learned in electronic medical records. Okay, that is put in place as an incentive plan of physicians to enroll in electronic data interchange to help rid the use of paper. So they no longer use paper, they use the electronic data interchange. Okay, capitation contracts and fee schedules. So let's talk about that, capitation contracts and fee schedules. So I'm going to erase all of this. Okay. HMO. Okay. Let's suppose this is Cigna. Okay, we're just using this for an example. We're not talking about Cigna on purpose. We're just using it as an example. Okay, so let me kind of straighten up my board a little bit. Okay, so you have HMO. HMOs have what you call copays. Okay, and with the copays are like $40. Okay, and let's suppose with the $40, they have up to 20 office visits. They have up to 20, well, not even 20, let's say 40. They have up to 40 visits a year, okay, to their PCP, okay? 40 visits a year to their PCP, okay? Now, let's suppose that they see a specialist, okay? Specialist is $60. They too have up to 40 visits a year, okay, to see a specialist, okay? Now, capitated means that they have put a cap on the amount of care that's being done, okay? Normally, the patient can see, let's suppose, for an initial office visit, okay? OB, an initial office visit, okay? And that's one time $40 fee, okay? And then let's suppose that they come back for the same issue, okay? Okay, that's going to be another $40, okay? And let's suppose they try something else on the second time and they come back the third time for the same issue, okay? That's another $40, okay? So they have seen that doctor 3 weeks out of 1 month, or maybe 2 weeks in that month and 1 week the next month. They have seen that doctor 3 times, period, okay, for the same issue. They have now maxed out. They have now maxed out for that issue. What should they do? They should get a what? Referral. Once they get a referral to the specialist, then the specialist is going to see the patient 1 time, 2 times, and then maybe 3 times, okay? And then he's going to give back a letter to the PCP, about the patient. Okay, so let the primary care physician know how the care of the patient was going. Okay, so that's how that goes. All right. So it is capped. Okay, and there's a cap amount per month. If that doctor, the PCP, can resolve your issue on the first time around, can resolve that issue maybe on the second visit, your PCP, then he has basically controlled cost. He has basically saved the insurance company money. Okay. He has basically kept the insurance company within a budget. So at the end of the year, when they go back to the employer to say, okay, you've assigned 1,500 employees, you gave us a maximum budget of $5 million to work with. I'm just saying $5 million to pay for the patient, for each employee to utilize. We have saved you, the company, through Cigna, what we charged you. We have saved you $1,250,000. So, how did we do, Mr. XYZ Company? Do you want to re-sign with us again? Do you want to better the plan? Because we're the HMO seems like it's working pretty good, and the capitation, which limits the patient and all of that, has been managed very well. So here's the inside scoop of how that works. When the PCPs save you money, normally on a capitated cost like that, they get some sort of incentive, and they're not saving money so much to rob you of your health. It is to save you money to keep from overuse of your insurance or abuse of the system, if you will. Because a lot of times we can see a physician for things that are truly not necessary. And I'm not being heartless, that's not it. It's just that you can see the physician and he can treat it on one time, and that's all you need. And you just got to have faith on that. Sometimes if you need that second office visit, that is fine. If you need the third office visit, okay, he's gonna say, you know what? I really think this first, second time that we had this talk and treatment, it really worked. I'm gonna try this, but I'm gonna also give you a referral. You go out to that specialist, and that specialist say, ma'am, sir, you're fine. You know, you're okay. But just to hear from a specialist standpoint, when you hear that you're okay, then that solidifies in that patient's mind. Okay, well, I guess my PCP was right. Okay, and that's great. I'm not doubting self-advocacy. Please don't get me wrong. I think self-advocacy is great. You should inquire. You should ask. You have every right, especially if you're paying premiums every 2 weeks out your paycheck. You have every right to do that. Okay. I'm just saying sometimes you have others that tend to go a little extreme. Okay, let me just put it like that, a little extreme. Okay, but that's my inside scoop. Okay, so capitation and fee schedules. Now, we're going to talk about fee schedules for a minute. Fee schedules as far as CPT codes. CPT codes. What book is used for CPT codes? Is it the ICD-10? Is it the Hicks-Picks book? Is it the CPT book? It's the CPT book. Thank you. No, your TPC. It's the CPT book. And I'm going to basically say 2018 since we're in 2018. So it's the CPT book 2018. Okay, fantastic. And the CPT book tells what kind of codes? Diagnosis code or procedure codes? Procedure codes? Procedure codes. Okay, very good. And procedure codes tells what? What the doctor did or what's wrong with the patient? What the doctor did. What the doctor did. Thank y'all so much. What the doctor did. Okay. Very good. Okay. Now, The CPT codes, when we learn about the 99201 or the 99202, and these are written by AMA, American Medical, keep writing this, okay, American Medical Association, okay, the procedure codes are written. The fee schedule, which is the RVS, was written by Healthcare Financing Administration. Okay, Healthcare Financing Administration. Now, who fathers Healthcare Financing Administration? I'm glad you asked. By Centers of Medicare and Healthcare Administration Services. I'm sorry, CMS. Centers of Medicare, Medicaid Services. Okay, they are the one that fathers. Okay, they fathers HICFA. Okay, now it used to be back in the day we had the HICFA 1500 form, and then it later got renamed as the CMS 1500 form. Then it got further updated so that it can accommodate 12 diagnosis codes. Okay, so CMS fathers Healthcare Financing Administration. Healthcare Financing Administration writes up an equation. They write a mathematical equation. Let me put this in a different color. Let's write this in red. They do a math equation to give a dollar amount, for the procedure code, okay, for the procedure codes, okay? All right, that's why when you're in high school and you're learning algebra and you're learning orders of operation, and then you're learning algebra 2 and how to use those Texas Instruments calculators. It all makes sense for reasons as this. You never know where your destiny is going to take you, where you're going to have to learn how to utilize those equations, how to utilize variables, how to utilize and find the end result to get what you need. There is a chapter that gives a calculation of how the 99201 is amounted for pay. Okay. Now I write all this up here. So now let's give an example. So I'm going to erase all of this. Let's talk about contracts and fee schedules. Okay. Now, let's suppose a patient has a Cigna ELB. Okay, Cigna ELB. ELB means explanation of benefits. I'm trying to get that out. Yeah, I heard you. Okay, explanation of benefits. It tells you, or sometimes for Medicare, another is called remittance advice. Remittance advice, okay? That's another term that's being used, but it's more so used for Medicare. Okay? All right, so EOB. All right, so you have the patient. So we're going to say the patient is John Doe. Okay? And John Doe saw Dr. Allo Dr. Alavira. Okay, Alavira. Okay, Dr. Alavira. Okay, and he saw him May 6th, okay, 2018. And he saw him for 99201. Okay, now you have what the charge is right here, okay, and you have what the contractual rate is, contracted rate, okay, and then you have um, what the reimbursement is, okay, okay, and you have the adjustment, okay, and then you have what is paid to the provider, okay, the end result. All right, so this has a box of its own, 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 and this has a box of its own. Okay, fantastic. Okay, so now we're going to draw lines. Oh, you know what? Let's draw a line with the blue. Okay, so here's the blue, and here it is here, and here it is here, and here it is here. So I'm just drawing an example. Okay, so 99201. Now, hi, Mr. Jackson.
Tag you in. I
Oh,
gotta teach
man.
tonight.
You gotta teach tonight. Tag, I'm in.
You it. You it. It's already on and it's on one, so just push that button right there.
Okay,
And you
sir.
got me.
Okay, thank you, sir.
I always say that. Thank you, sir.
Oh, man. I'm tagged tonight. Okay, cool. All right, no worries. Okay, so 99201. All right, so let's suppose the 99201 is $100. Okay, and the contracted rate from Cigna is $80. Okay, and we know that the reimbursement is based on uh, the subscribers insurance underwritten policy. Okay, underwritten policy. Remember I said the other day, I said it on Monday, that just because you work at Kroger's in Houston, Texas, and I'm just giving an example, just because you work at Kroger's in Houston, Texas versus Kroger's in Mississippi doesn't mean that the Kroger's coverage that they offer their employees in Mississippi is going to be the same for Kroger's in Texas. Okay? Their regional district office may be a bit larger or different, and their employees' numbers may be a bit larger and different versus what's in Mississippi or versus what's in Texas. And what needs to be catered to need to be written a little bit different. Everything is going to, according to statistics of disease, according to region of the disease, the age, the sex of the person, that gives a reason why certain insurance are underwritten a little bit more in prices in one state versus another state. Regulations are a little bit different in Mississippi than it is in Texas. Regulations are a little bit different in Louisiana than it is in Texas. Some things may be a little bit more easier to acquire in Louisiana than it is in Texas. Do you get what I'm saying? Regulations are regulations according to the state. CMS is the mother of all state regulations. It's up to the state, the governor of that state, and the governorship of that state of how they regulate the funding that comes from CMS for everyone in that particular state, or Medicaid for everyone in that particular state. Not all states rule the same. Okay? It's just like Canada. Canada has providences. Not all providences rule the same. Okay? And I happen to be a fan of Canada. So, anyway, so according to that person's policy, so let's suppose that person's policy has a $20 copay. John Doe has Cigna, he has Cigna HMO. Okay, he has Cigna HMO. And for his PCP, he is to pay a $20 copay. For his specialist, okay, he is to pay a $40 copay. Okay, so let's suppose Dr. Alavera is a PCP. Okay, he's his primary care physician. So he come in to see Dr. Alavera because he stubbed his toe and his toe is purple. So he don't understand why he got a purple toe. Okay, so the reimbursement for that, okay, with copay, okay, this is hindsight, it's not going to say that. His reimbursement is going to be $60. Okay? Why? Because you have to say 60 minus 20, 80 minus 20 is going to be 60. Okay? Now, the adjustment rate, let's talk about that, the adjustment rate. Now, the insurance company made a deal with Dr. Alavera. Dr. Alavera says for every patient that I will see under your insurance plan, I am going to contract $80. Okay, and the patient pays $20, so there's $60. Okay, so in this instance, and this is an okay example, but just give you an idea, and I give you another. Let's suppose there is no $0 adjustment, okay? And so the doctor is reimbursed back, what, $60, okay? Now, let's suppose John Doe comes back in to see the doctor. He comes back in May 14, okay? And this time, he has spent a little bit more time with the doctor. The toe has healed, but the toenail fell off. Okay, so he's rather concerned about that fallen toenail. He's just like, oh my God, I think I'm dying. I don't know why that toenail fell off. Doc, you got to check this out. And I see pus coming everywhere. And I just don't know what's going on. Okay, so now that CPT code is 175. Now, the contracted rate for this is going to be $100. Okay? It's going to be $100 for that visit. Okay. The patient, again, same thing. We're looking down here, okay, with the copay. He paid the copay already. Okay, so please pay attention. Okay, the copay. So now they're going to pay him. So let's see here. Reimburse him at wait a minute. Copay is $20. Okay. And the reimbursement is going to be $80. Okay. Now, $20 minus $80. Let me write this because it's going to end up being a negative number. So let me write it the other way. $80 minus $20 is going to be $60. Okay. So now the doctor is going to get paid $60. Okay. So the reimbursement says the policy, once the patient has paid their $20 copay, they'll be reimbursed $80. The adjustment here is going to be $20, okay? And the doctor is going to get paid $60, okay? I'm trying to make the math make sense to you. I have to have an actual EOB to explain it perfectly, but it gives you an idea of how to read the adjustment. Now, you're probably looking at the adjustments right here, and you're probably saying, well, what do we do with these adjustments? Okay, this $20 is just hanging in the wind. That $20 is going to get billed to the patient. Well, the patient just paid $20 copay. Well, I'm glad you asked. I'm glad you're upset about it, so let me calm you down. So it's going to get billed to the patient, and the patient is going to have to pay the residual of whatever the insurance company did not pay. That's how that works. Okay? Now, you're going to send a what? A letter out to the patient. You're going to have that conversation with the patient. That conversation is going to be done by letter. So, go to page 298. Oh, this is a perfect example of an ELB. I should have used this example. Okay, I may come back and use that another time. Okay, now, you're going to send out a lovely letter, okay? A letter goes out to the patient. So a letter to the patient, okay, for the first 30 days, okay? Then on day 25, you should be making a phone call, okay? If you get no answer, then you're going to send out a second letter, okay? Which is now 60 days. Okay, so another day. So day 50, you should do a phone call. If the patient has not responded with the payment, you need to do a phone call on the 50th day. Now you're going to send out a third letter. You'll be like, that lady kind of hard to catch up with. Okay, let me call her at 7 o'clock. I know she should be having dinner with her family right about now. Okay, so this is going into the 90 days of what this is called. This is called aging report. Okay, aging report. Okay, all right. And so you calling her on the 75th day. You calling her, you're going to be real clever. You're going to call at 7 o'clock. She's having rigatoni and salad and garlic toast and a glass of wine with her family. And the children are having Crystal Light. Okay. And so she's just enjoying herself with her family. And what did she get? A phone call from you. Oh my God, how dare you call me during family time? Well, ma'am, I've been trying to call you at 2 o'clock, 3 o'clock. I even tried to call you at 5 o'clock, hoping I can catch you while you're riding in the 5 o'clock traffic jam. Maybe you could talk to me. It's 7 o'clock. I can call you, ma'am, up until 8:45. I can't do that, ma'am. You do have rights to do that, okay? All right.
Oh, there is. I'm sorry. There is a time limit.
Yes, they can't call your house past 9. They cannot call your house past 9. Whatever your time zone is, they cannot call your house past 9 according to your time zone. Yeah. Mm-hmm. Okay. Glad you do. Okay. Thank you, Chris.
I get phone calls every time. Random phone calls.
Yeah. So 9 o'clock, they have until 8:45 to call. That's what do you call that? That with the TV stations and FCC. That's according to the FCC regulations. There you go. Okay, now you can go on and on and on. 90 days, 120 days, 180 days. You can go on and on and on and on and on. Okay, that's how that works. Now, if the patient is not responding by letter, they're not responding by phone call, but there comes a time they're going to have to come in and see that doctor for a problem. They're not going to want to start over somewhere else, filling out all that paperwork and be treated as a new patient. They want to come in and feel a little bit more special because they've established relationship with you. So that means that when they come back in, when you set the appointment time, you need to reflect back in their record. Do they owe a balance? I need to ask them, ma'am, sir, you have a $500 balance. How would you like to take care of that? Okay. The patient may say, ma'am, blah, blah, blah. I need to, can I pay $30 right now and make payments? Yes, you sure can. So there's always more than one way to get the patient to do what they need to do. We just have to find that way and then be kind about it. Okay. Now, they should already have on the paper that when they sign the financial obligation, that you have given them all rights to sell the bill or to sell their account to another debt collector to collect on that account. Okay. And again, they could have a law firm or an attorney to write that up and to cover them so that, they're not losing money and they're making money, because they got to make their money. Okay, so posting explanation of benefits. Okay, so this is all interpretation, so I'm kind of skipping around. I'm on page 299. This is posting payments. So now the doctor has gotten paid. Yay! So now you can post this payment to John Doe. Check. We can post this payment to his account. Okay. John Doe got another check from Cigna. Check. We could post this payment to John Doe. However, John Doe owes $20. Okay. Until we get that payment in the mail in person or however, John Doe balance is not zero. John Doe still owes us $20. Now, you're probably saying, well, I pay $500 a month for insurance. Why am I still paying so much money? Ma'am, sir, it's a blessing to have insurance coverage. I'm going to tell you straight up. Being a 5-year breast cancer survivor, it's a blessing. It's better to have insurance coverage than not to have any at all. It's better for them to pay something than not to pay anything at all. So if I were you, on a personal level, and this is just me talking, be grateful. Be grateful. Okay? All right, secondary insurance. Secondary insurance is for coordination of benefits. Remember what I said earlier on. Coordination of benefits are for children. They're for dependents. Hi, Dr. Dunlap. Okay.
Good afternoon.
Good afternoon. They're for children. They're not for grandma, grandpa, Medea, Big Pop. No, they're for the children. Okay? Now, let's suppose that the child, let's look at this. I think, can I erase this? Sure. Okay, thank y'all so very much. Moving right along. Huh? Okay. So I'm going to reiterate on what I talked about, coordination of benefits. Can anybody tell me a little bit about coordination of benefits? Is there such thing called the birthday rule? Yes, there is a such thing called the birthday rule. And why is the birthday rule necessary? If you have kids. So let's suppose John Doe's birthday is March 29th. Sally Sue's birthday is September 2nd. Whose birthday comes first? March. Who? March. Okay, which is the dad, which is John Doe. Sally Sue's birthday comes second. Then you have to resubmit that as a secondary bill. Okay? All right. Now, let's go back to this illustration here. Okay, so EOB management. So let's talk about that, and then we go back to EOB management. All this falls under EOB, explanation of benefits. Let's talk about the management of explanation of benefits. Okay, so the management of the explanation of benefits. We have to understand that once we interpret the benefits, okay? We have to understand, is it what? Paid? What's the other one? Pinned? Or what? Denied. Okay? And we have to also understand, once we interpret it, does it need secondary billing? Okay? Now, if it needs secondary billing, then yes. Yes, and what do we do? What do we do? Okay, what do we do? All right, this is what we do. We have to consider if it is an EE, employee and spouse situation. Okay, now the EE is what? The subscriber. What is another name for subscriber? Starts with a P. Okay. Policy holder. Very good. Policy holder. Okay. Now, let's suppose that James Doe. Okay. So we have James Doe. Okay. And James Doe has Blue Cross, okay, and Blue Shield insurance. Sally Doe, okay, has Cigna. Okay. Now, let me say this as a disclaimer, and I'll say it again in writing so that y'all can remember this for all my visual learners. COB does not apply. Does not apply in this situation. Okay? Does not apply in this situation. Okay? Now, John Doe, John went to the doctor. I'm sorry. Is it John? Oh, James. Okay. John about tired of me. So I'm going to use James. Okay, so James. James went to the doctor. Okay? He went to his PCP. His PCP utilized his Blue Cross Blue Shield. They filed it, and then they got an EO back from Blue Cross Blue Shield that says that Blue Cross Blue Shield paid $100 for the visit. The residual is $150. Okay, so this is paid. Okay, from Blue Cross Blue Shield. So we're gonna put a check mark by this. Check paid Blue Cross Blue Shield. Okay, what should we do when we get payments in? I said it once before. Once we get payments in from the insurance company, what should we do with it? Mark it as payment. Very good. Thank you. Then we need to post it. We need to post the payment. Okay. All right. So once we post the payment, now he has coverage. So let's write this under here. James has Blue Cross, Blue Shield, and Cigna. Okay, they're husband and wife team. Sally has Cigna and Blue Cross, Blue Shield. Okay, see how that works? Okay, so since James seen the doctor, since he is the EE, the employee of his insurance, okay, his insurance should always be filed first. Now, when that EOB comes back from Blue Cross Blue Shield, they paid $100. The $150 is residual. Okay, it's residual. So what are we going to do with that residual? We're going to send it to who now?
Just secondary.
Secondary insurance. Very good. Thank you very much. Okay, so now his secondary insurance. Let me see how this green was. All green. Oh, that's pretty. Okay, that writes real pretty. Although I'm gonna borrow it, but I'm not gonna keep it. Okay, because this one is mine. I love markers. Okay, I love markers.
I do too.
Okay, I'm just letting you know in case I get some more in color. Think about me. Think about me. Think about me. Okay. All right. So now we're going to do secondary billing. Okay. So this is called. Remember, I told y'all that there is such a job called what? Secondary biller. Okay. So if y'all see those jobs, go for it. Okay. Once you get in the field or been in the field 6 months to a year, you know what you're doing. Yes. Okay. Because it's a little bit more tedious. It's a little bit more tedious. It's all about the money, huh, Chris? It's all about the money. Bless your heart. Okay, so now we're going to send it to the secondary biller. This time we're going to send the Blue Cross Blue Shield EOB, okay, and a fresh, okay, CMS 1500, and you can send it soft copy or you can send it hard copy. That's fine. They'll accept that because sometimes you can scan an EOB and send it back secondary electronically and attach it to the CMS 1500 electronically. Okay. Now, not all billing software is the same. Sometimes you're going to have to print up that CMS 1500, put on there that the $100 has paid, and then still send a copy. Remember, I told y'all when y'all get those EOBs back, or you print those EOBs, to make sure you date stamp the day that you have worked the work, okay, and that you're getting ready to send this off. All right, so you send the Blue Cross Blue Shield EOB. You send a fresh 1500 form with it being paid of the $100 from Blue Cross Blue Shield, okay, and to show that the previous one, and to show that the $20 copay was paid, okay, so we just make it up a copay. So that means that Cigna has to coordinate, okay, payment towards the $150. Okay, y'all getting that? And so let's suppose that Cigna pays. They pay $100. Okay, so what do we do with that check when we get that from Cigna? What do we do with that? We're going to post it. Very good, Chris. So we're going to post the payment. Okay, so now once we post the payment, what does that leave us to bill the patient? $50. Very good. So it leaves a residual of $50 to bill the patient. Okay, now the patient may call you upset. Doggone it, I pay $500 a month premiums through my paycheck. I pay y'all $20 copay. The insurance at Blue Cross Blue Shield pay this. The insurance at Cigna pay that, and I still got to come out with more money, sir. That was a lot. Well, you can't tell them that exactly, Chris. You could just say, sir, if you have any disgruntled about your insurance, you need to take that up with the human resources at your job about your Blue Cross Blue Shield, or call Blue Cross Blue Shield or Cigna and let them help you, sir. We can only go according to the policy that they have written for the insurance, okay? Be kind and sweet to them. Don't argue with them. Just be kind and sweet. And that'll hopefully. Okay. All right. So we all understand how that works, right? Okay. So aging reports. So we talked about the 60-day, the 90-day, the 120 days. Sometime it goes 180, which is 6 months. Okay. All right. So purging paid files. Let's look at that. When claims are paid off and have a zero balance, they are purged. removed in bulk from the insurance claim file. So remember the other day when I talked about purging files, maybe that was with my day students. I talked about purging files that you have to make a list of all the patients, of all their electronic medical records or all of their paper-based medical records that you're shredding their files, okay? So you have to shred them. If it's over 7 years, you're going to learn that in the next term.
You said 180 days.
No, this is different. Okay. Payment files are different from medical record files. Okay. There's a different destruction policy for that. Okay. If it's 7 years from the first date of service, then you have to make a list of all the files that are 7 years from the first date of service before you destroy them. And you have to put them in a shredder bin for them to be destroyed. Okay. This policy here on page 300, it says it a little different. So it says some medical offices remove files when EOBs are posted, but this process can be time consuming. Scheduling regular purging of paid claims reduces the resources need for the payment posting process. Most medical software programs offer practice management reports that can be used to track insurance payments. The most efficient way to purge patient accounts is to run an aging report. Remove all accounts that have a zero balance. Once the insurance payment posters have this report, they can forward the aging report with current balances to follow-up specialists to obtain the status of the outstanding claims. So you have to do it, and sometimes you can purge them just like that and put them in a separate file. So all of the zero accounts, they're in a separate file. Those that still owe money are in another file, but you're trying to make room inside of your hard drive. Okay, if that makes sense. Okay, so it still run at optimal speed. Okay, now let's look at claim inquiries on page 301. So here's a perfect example of an aging report. If y'all could see this figure 9-3. Would you like to look at a figure 9-3 now? Okay.
I'm just enjoying it. Like,
Okay, great. Thank you. Thank you. Okay, so the aging report shows patient account balances according to the number of days after the date of service. So you see how all the patients here, some of them have zero accounts in certain days and some of them have balances. So this is just a perfect example of an aging report done at a doctor's office. So let's read the claim inquiries. So it says here, when reviewing an aging report, unpaid claims that are more than 30 days old require that an inquiry on claim status to be made to the health insurance company. These claims could be delayed because they may not have been received by the insurance company or for other reasons relating to the member's health plan. Different types of claim inquiries can focus on denial codes of the EOBs, or it can be related to patient coinsurance or deductible responsibilities. To reduce the number of phone calls to the insurance companies, many private insurance organizations have set up online physician web portals that allow insurance billing specialists to receive patient claim status and benefit information. If more information about the claim is needed beyond the scope of the online portal, insurance benefit specialists can be reached by calling the member service number on the back of the patient's ID card. The following are reasons for making inquiries. And so they have a lot of reasons right here on page 301. So I'm going to let y'all read that on your own time to see how that works. Let's go to page 302, where it says about tracer forms. So to inquire about the claim, if any of these situation occurs, while there are many online provider web portals for private insurance claims inquiry, sometimes government health plans do not offer the same online tools. For this reason, government health plans have their own inquiry or tracer forms available online that needs to be submitted in writing along with a copy of a claim. Okay, and so you have some uh, insurance claim problems when there's a delinquent claim, when there's denial claims, when there's downcoded claims, lost claims, and overpayment, payment errors, pending claims, rejected, and third parties. Again, I can't say it enough. Whatever you all do, don't throw away your books. Keep your books because you can always refer back to them in case you need information, and it'll make sense to you. And remember, I'm not just your teacher, I'm your mentor for a lifetime. So I've been in the field 32 years. So if you ever have questions that need to be understood, I am here. Okay. All right, so we're going to skip along in here. This talks about denied claims. I think I've kind of beefed over that real good about what to do with denied claims. That's page 306. You have payment made to the patient. They give problems and solutions, which is very good. Overpayments can happen. I'm on page 308. Can happen for a variety of reasons, but handling them can be challenging. And remember when I told you guys, like I told my day class, you have to highlight box 27, assignment of benefits. If you don't highlight box 27 and that check accidentally goes to the patient and they're sitting there talking about, oh, I received a blessing. Oh, God bless me. No, he didn't. That was a mistake.
If I receive a check, I'm cashing it.
You cashing it. Of course you would cash that check. But guess what? You're going to get a lovely phone call from the doctor's office explaining that that check was accidentally sent to you.
I would say.
And you gonna say,
I accidentally cashed it.
Or like Brenda would say,
Don't punish me for your mistakes.
don't punish me for your mistakes. So that's not my problem. Okay, I understand. Well, now guess what ends up happening?
That person get fired.
Well, no, that person's not going to get fired. What ends up happening is they're going to reconcile your account and they're now going to bill you for that money. Or they'll let the insurance company know that we tried talking to you to get that money back. And you might receive a letter from the insurance company saying you got to pay that money back to the insurance company so we can pay it to the physician. Or that physician might not get paid for so much of what the worth was of that check because they dropped the ball on not checking off that assignment of benefits box. You moved, okay, that works too. Okay,
Are we
well,
gonna have access to the online books still even when we leave?
access to the online bookstore?
Books, yeah.
Oh, you know what? I don't know. Now that's a question I have to ask, my director. I don't know. That's a good question.
I don't think so.
Text me that and ask me.
But I think we have access to the resource library.
Yeah, you do. You do.
I think that's what they said.
Okay.
Come here and check the library.
Okay. Okay, awesome. Text that to me, sweetie, and I'll ask Ms. Shackelford. But that is a great idea. The library has all kind of resourceful information. Okay, so rebilling, we talked about that. Review appeal process, it talks about that on page 311, and filing an appeal. So if you need ideas on how to file an appeal, go to page 313. Now, y'all should do a letter writing contest. I'm sorry, not a letter writing contest, a letter writing assignment in your book that should teach you how to write a letter of an appeal. If ever you need to, please Google that on appeal medical insurance appeal letters. They have that on the internet where you can kind of get an idea of the verbiage you should be using, the correct grammatical skills that you should be using when you're sending out a letter. Okay? All right, so moving right along. This talks about TRICARE. This talks about Medigap, blah, blah, blah. And I'm going to talk about this a little bit later. And This also is a cover letter signed by a physician on page 320 for appealing a claim. So this is another perfect example on appealing a claim, okay? All right, so let's look at the key points on page 321. Here's some of the key points. Payment from a third-party payer after submission of a paper claim should occur within 4 to 12 weeks, and of an electronic claim should occur within 7 days. I'm just sporadically going through. Number 3, routine periodic checks of the insurance claim electronic tracking report or insurance paper claims register should be done to follow up on delinquent claims. Number 4, the individual handling the front desk must collect insurance information accurately and update the demographic information routinely to avoid future collection problems. The front desk person should make it easy for the billing person to do their job. Okay? All right. Number 6, a decision to appeal a claim should be based on whether there is an ample information to back up the claim and if a substantial amount of money is in question. Number 9, to complain about a problem with an insurance contract or claim involving a third-party payer or even Medicaid plan, the state insurance commission must be state of Texas. So the Texas Board of Insurance would be your insurance commissioner to contact. And number 10, always file the appropriate form or write a letter to begin the appeal process for resolving an insurance problem or complaint. Okay, so this does it and wraps it up for chapter 9. Does anyone have any questions? If you're going to do the job of chapter 9 in recovering payments, your job would be a collector, accounts receivable person, payment posting, secondary biller, insurance verifier, appointment setter. All those type of jobs solidifies around this chapter. Okay. All righty. Well, that ends it today for chapter 9 in the Fordney Insurance Handbook, the 14th edition. I want to thank you for tuning in to THCOD and letting us help you change your world and make it better for your health information. This is Tara in Harper. Have a wonderful evening.